we hear the term equity all the time, and I think often we confuse it with this other word, equality, right? So it's really important to note that equality and equity are not the same thing. And I think many of us have seen that graphic where you have some people standing on, some boxes and trying to see a baseball game, right? I think it's a really great one to exemplify that basically when we're talking about equality, we're talking about everybody receiving the same thing, right? And I would say that in many cases, especially as it relates to health and the opportunities for good health in our country, we still have lots of challenges in reaching equality, so everybody receiving the same. But equity is a very different concept, which really is predicated under the idea that not everybody deserves to have the exact same in order to get to the same outcome. So it takes sort of different opportunities, different resources, sometimes different assistance based on how we're starting, based on where we're beginning in order to get to the same place. So, that under that same kind of graphic, when we think about equity, we might give somebody 3 boxes to stand on to get them to the exact same place that somebody that might not need a box at all is standing on, right? We're starting at very different places in our country and in our society. So when we think about equity, we're thinking also about fairness. It's really based on a concept of justice. What is fair? And in many cases, that's what makes it so complicated, right? Because we have different ideas about what's fair in this country. And also, fairness is really tends to be based on kind of moral values, tends to be based on your experiences, what you've been exposed to, all kinds of other kind of cultural factors. And so it's really not so easy to determine what is equitable, what is fair, what is just. Whereas actually figuring out what equality looks like, as complicated as it is, tends to be a little bit easier to define, right? So when we think about health equity, we're really talking about the opportunity for all of us to have good health. And so for some of us, we might need more resources. We might need more help. We might need more barriers to be moved out of our way in order to achieve health equity, which is like health justice, fairness in terms of health opportunities, our opportunity to be healthy within our lives.
So, not to be too reductive, but would you say then that we are striving for a quality of health outcome, but we need a system that is equitable in terms of how do we each find our own individual journey toward equal opportunity for health?
Yes, and I think that's a beautiful way to put it, right? We are looking for equality in health outcomes, but we know again, and just what you mentioned as well, in order to reach those equal health outcomes, we all have very different sort of paths that we need to go down in order to receive it. And so in order to have that opportunity, and again, of course, there is sort of individual choice and there is individual responsibility, but when some of us have so many barriers put in front of us, our opportunity to reach that kind of equal outcome is very different than other opportunities. And sometimes that's at an individual level. Often it's at a community level. And again, that's what makes this concept of equity so incredibly difficult, because we're really talking about what's fair. And we're saying that in order to be fair, some people, some communities are going to need more help, are going to need more resources because the barriers are bigger, because the hurdles are larger, and often they're systemic and they're historic and they're tougher, right? And so we haven't all agreed on that concept, nor have we agreed on our willingness as a society or ability as a society to remove those barriers in the way that it really takes in order to get to those equal outcomes.